Hello everyone, I'm Dr. Sushan Shetty, consultant ophthalmologist at Dr. TMA Pai Hospital, Udupi. So today I'll be talking about vision screening and testing in children, which is most often ignored. So a lot of parents, they come to us, they're like, when should we check our child's eye? So I feel that every child in infancy itself, when they're a few months of age itself, the vision has to be tested. So parents are like, how do we check vision in such small children? So we have specialized instruments, some drops that we put in children, which tells us if a child requires glasses or not. And nowadays, a lot of schools, which is a very good thing, they have a lot of screening. Regular eye screening is there in the schools, which is conducted, which is really important to come to know if the child has good vision or not. So all this is also very important in children. Another thing which happens is parents are like, how do we come to know that the child has, does the child, he or she have a glass power or not? So I'll just give an example of my own sister. So when she was in school, she used to go very close to the TV and sit. She's like, Mummy, I can't see anything. What is this? And she used to, make her eyes small. So we never realized what it was. And then when the teachers in school told us that my sister is not able to see, she was sitting in the last bench, she's not able to see clearly, there's a lot of blurring which is there. So all those things tell us that the child has a spectacle power, a glass power. So blurring of vision, sitting too close to the TV or digital devices, like nowadays we have mobiles, tabs, frequent rubbing of the eyes, like itching of the eyes also can tell you that the child might have a spectacle power. Headache, a lot of children when they come to us, they'll have a lot of headache. And then that's when we examine and we see that the child has a spectacle power. So that is another thing. So these are the things which the children come with. The parents and even the teachers in school notice, the child is not writing the notes properly, there are a lot of spelling mistakes. So all these things tell us that the child may have a glass power. Now, there are a lot of children who, even if they cannot see clearly, they'll be like, I can see the board properly. So why is that? So because most of the children don't know what is normal vision. They'll be like, for me, this is normal. But when they come for eye test, actually, they're not able to see clearly. Another thing is, so this was about the vision screening. When should you do it? The teachers should encourage in schools. Nowadays, they're having a lot of screening camps, as I told you. And when they come for the test, when they come for their pediatric visits over here, for their vaccinations, for their injections, that time, please make sure all parents that please, get an eye examination done. Because the earlier we diagnose these things, the earlier there is a better chance of treatment. Another thing is now the child, when they come, they'll be like, parents will be like, now glasses are there. Okay, you have given the glasses. Should my child wear the glasses regularly? Yes, of course. Like once you've given the glasses, in order to see clearly, you have to wear the glasses regularly, especially for near work, when they're doing their homework, they're doing their studies. So it's very, very important to wear the glasses regularly. That has to be told to the child and the parents. A lot of parents are like, ma'am, you tell. If the doctor tells, it's more effective. So even if we tell, at home, the parents should encourage the child to wear the glasses and also improve their outdoor activity. See, a lot of kids, what happens nowadays, because of all these mobiles and tabs, a lot of children don't go and play out. They don't know what is outdoor activity. So that is very, very important. So please encourage your child at least half an hour a day. Let them go out cycling. Let them go out play with their friends. So that is very important. Like full time in the screen can increase, the spectacle power. Another thing which I always come across is the parents come and tell, okay, now my child has worn the glasses. Like I had a patient few days back and they're like, okay, now doctor, my son or daughter has glasses. Do I have to, will the power keep increasing? So see, the human body, we keep growing, right? So even the eyes keeps growing. So when the eye keeps growing, even the eye power also keeps increasing, okay, with age. And by 18 to 20 years of age, it will become stabilized. So there are a lot of patients, like people, if you have seen, they have thick glasses. So a lot of parents, when they come, they came and asked me, is there a permanent solution for this? Can my child get rid of glasses forever? So there are options. Like till 18 to 20 years of age, you have to wear your glasses. But after that, there are other options. There are contact lenses, there are other procedures that can be done. But as a child comes to you, before 18 years of age, glasses is the only option which is there. And there are a lot of children, when they come to me, they're like, I'm very shy to wear glasses, ma'am. Like, other people make fun of me. I'm wearing glasses. They're like, Chashmish, what is this? You're wearing glasses. You don't think about others. I'm sure others also have a vision problem if they've not got their eye tested yet. So don't think about all of that. Please take care of yourself and your eyes, because the moment you see the world with a clearer vision, you'll feel better, and your in school, if your performance is declining, or if you're not able to see the board clearly, if you don't wear glasses, you cannot see, right? So do what's best for you. So if any of you are experiencing any of these problems, any parent is seeing that their child is, doing all this, or if the teachers feel that the child is not performing well in school or is having difficulty in seeing the board or any headaches, so please consult your nearest ophthalmologist. Thank you.